First of all, I'd like to thank you for this second opportunity to be here in this wonderful meeting with all of you. And it's an honor to be part of this team. Let's talk about a little bit how to rejuvenate an asymmetric face with fillers. Well, here is about myself, a bit about myself. I'm a e.p.t.q fillers and video thread speaker. I spent some months in the United States of America in a cosmetry fellowship for ethnic skins. I'm CEO at my private clinic, and I have my own workshop, hands-on workshop with threads and fillers here in Brazil. And today I brought a special case to discuss with you. But quickly, let's talk about the process of getting older. We know that it is a 4G change: bone reabsorption, ligament and muscle weakness, fat pad drooping, and skin laxity. And we can see here that bone reabsorption increases the hollows, like in the eyes and nose area. And because of that, all the structures above suffer changes and deflect. And we know that the aging process is different between ethnicities as well. Thus, in order to facilitate this process, there are some facial aging classifications to help us understand and guide our treatment practice or plans. Here I brought one of them, and moreover, it is critical to know facial anatomy. Here are some warning signs, like when the vessels and nerves go superficially in the forehead, the path of the facial angular artery, and the main foramens that we can superior, orbital, infra, and main 2R1s. And here, a little bit more, which structures are superficial and which ones are deep, the path of principal vessels and nerves in the temple area, and the most important thing, how to identify these structures in our practice. So here, this article suggests finding a way to clinically identify the most important anti-aging vector force in the upright position. And it could be found that it is a narrow strip of angle around 51 to 55 degrees from the mandible bone here. In addition to all of it, and knowing all the ways to inject fillers, knowing the rheologies of the hyaluronic acid that we choose to do, and what we can get, we can individualize all the treatments and offer a wonderful physiological and natural beautification. And the thing is, I was challenged to give a global improvement to this face, I will show you, with a total amount of 7 syringes of e.p.t.q fillers, 3 S500, 2 S300, and 2 S100. Let's see the patient. Here we are, an asymmetric case. She is 53 years old and never got a cosmetic procedure. As you can see, she has a huge asymmetry between the sides, with different fat pad distribution, different depth between the tear trough and cutaneous zygomatic ligament, and a more evident labial mandible fold in the left pre-jaw area. The temple area in the right side is more reabsorbed as well. And we can see the bizygomatic distance is greater than the bigonial one, which is good for her because these proportions make face look more feminine Moreover, we can analyze her ugly curve, which is not the most attractive one, either one of the sides. What else we can see? We can see in this assessment. It's just sagginess and laxity skin. Did she has ptosis? So just to recap, the OD curve is known as one of the curves of female facial beauty. It corresponds to the S shape when looking at the face from the side. It is present in faces considered the most beautiful and indicates proportional between the convexities and concavities of the female face. As we age, these facial projections decrease, the curve becomes flatter, and these compromise the sensuality and beauty of the female face. Hyaluronic acid, fillers, and biostimulators allow this curvature to be recreated, leaving the face more harmonious, feminine, and attractive. Here we can see the anatomy of the superficial fat pad distribution. Then I have to think about the key structures that must be prioritized for my syringes of e.p.t.q fillers and give her a better symmetry. Again, some laxity scales for the eye area. In order to distribute my fillers, this area is very important in her face because in her mid and lower face, is the laxity equal in both sides? Does the sagging only exist within the orbicular area above orbicularis retaining ligament? Or does it cover the malar area as well? And again, is that equal on both sides? In an overview, the left side is saggier than the right side. The tear trough is deeper, and the nasolabial, middle cheek, and infraorbital superficial fat pads are more deflected. Looking at the right side, how better replaced and supported they are. Thus, all mid-face reflects toward the lower face, as we can see by the jaws. At the upper face, notice the difference between the temple area. The right side is deeper than the left one, as we can see here, which are the fat pads that supporting the eye area and some ligaments, some folds. So, first of all, I used my 3 e.p.t.q S500 fillers. I inject deeply in the supraperiosteal layer, here in the zygomatic area, and in the canine fossa with a 27 gauge needle. We can see in the left side that I added a few more ml in the subcutaneous layer to get more symmetry in both sides. But to pull the face up in the supraperiosteal layer, the ml quantity was the same. Here in the zygomatic area, I filled subcutaneously in different places, above the zygomatic bone, here, and below the zygomatic bone. Why? To try to equalize the OD curves. And because she has gray lateral orbital, middle cheek, and lateral temple fat pads, I could not inject too much in these areas. Why? Because she would end up with a round face. But here, in the posterior part of the temple fat pad, there was a hollow with a moderate depth. So I fill them in microbolus subcutaneously in a different quantity. In the mandible body, I filled retrograded, and everything was filled with 22 gauge cannula. So 3 syringes. Moving on, For volumization, I used 2 e.p.t.q S300 with this distribution, trying to get more symmetry between the sides. And everything was done in the subcutaneous layer with a 22 gauge cannula in fan or retrograded, 2 syringes. Still on this case, for fine tuning, 2 more e.p.t.q S100 with a 22 gauge cannula. That was my choice to spread them more wisely according to the asymmetry. And in the perioral area, always above the muscle, I lip line her mouth using a 30 gauge needle. I think that way I was able to outline in detail more accurately here into the justadermal layer, which is relatively safe with all the precautions, of course, because of the needles. But I put filler exactly here. So the whole treatment in one session, the filler overview, the S500, the S300, and notice the different amount of e.p.t.q filler between the sides is in red color, as you can see, the global session. The total amount, the number of syringes used was 7. The outcomes, the previous treatment, immediately post-treatment, and 30 days post-treatment. We can see all the superficial tissues were pulled up and better symmetry between the sides, better curvatures, and a better mandible contour with a flatter, plain jaw area. And her double chin improved as well. I think I gave her a more youthful face. But what's the most important is she's deeply satisfied with the outcomes. In my point of view, naturally enhanced faces and gracefully addressed aging changes is the key to customized beautification, lifting, and rejuvenation. Combining hyaluronic acid fillers, knowing its rheologies and brands leads the outstanding results. So every patient is unique. And in my clinic, combining treatments is the best way to deliver very natural beauty cosmetic treatments, using the least amount of each product and achieving satisfactory outcomes without blowing their budget. That's why this case was a challenge for me, using just HA fillers, because I have a hands-on workshop in my practice, combining threads and fillers. So I'd love to have your feedback. How would you do this case if you didn't only have only 7 syringes of HA fillers to do her face? How many syringes would you have planned to her? And in my opinion, globalizing knowledge, experience, and learnings is the most powerful wisdom. Thank you very much and hope you enjoy it.